Welcome back. I hope you enjoyed your brief break. My name is Kendra Flory. I'm the chair of Fourth Trimester Arizona Board of Directors, and I will be moderating this session, Child Development Challenges Persisting Post-Pandemic, an update. Before we begin, I am going to give my redundant notes regarding the use of Zoom for our sessions. For those of you who've been here all day, this is your reminder. You've heard me say this, but others may have been just joined us. So first off, our summit today is being recorded. So we ask that you please keep your microphones off while the speaker's speaking. You're welcome to have your cameras on or off throughout the day, but we encourage you to have them on if you're asking questions. And we will have a Q&A portion at the end of each session. And for those times and for sessions that are more interactive, please use the hand raise emoji to request to speak. And if you need help, the name of the tech support person will be near the top of your chat box in each session, so you can direct message them with questions. And the chat is also a great way to interact with your other attendees. And please review our legal disclaimer found on your screen. Here are financial disclosures for this talk. And I am pleased to introduce Catherine Tretiakova, our presenter for this session. Catherine Tretiakova is a nationally certified pediatric nurse practitioner and received her doctorate of nursing practice from Arizona State University. Dr. Cat is committed to promoting community health through promoting family resilience, injury prevention, wellness education, and supportive care for illness. She lives in the Valley with her husband and 2 young daughters. Together, they enjoy swimming, cooking, reading, video games, and hiking. Thank you, Catherine, for being here today. I'm going to turn the time over to you.
Thank you so much. And thank you so much to Fourth Trimester. Everything you do, I'm just in awe of. This is fantastic. So my name is Catherine Tretiakova, as she told you. I do work here in the Valley at Canyon Pediatrics as a pediatric nurse practitioner. I've been working as a pediatric nurse practitioner for about 5 years now, coming up in the spring. And before that, I was a registered nurse at Phoenix Children's Hospital, where I worked in the ICU. At that time was kind of like my first step into developmental peds, because I also worked on a sister floor, which was our trach vent unit. And that's where you're going to see most of like the most severely developmental disabilities, especially our trach vent population. So they've always really held like a really special place in my heart, because I worked with them for 5 years prior to going into private practice. So they kind of started my journey. And then, of course, working at a pediatric office, we do a lot of developmental screening. We see a lot of things, first line, fortunately and unfortunately sometimes. So it's been a fun, interesting time since COVID, since a lot of my career was spent in COVID. Please feel free to ask questions throughout this. I did try to make it briefer because I wanted you guys to be able to ask some questions about what we're seeing, those first couple of even days out of the hospital, infants we're seeing. We could probably talk about child development for 3 days. There could be a whole summit on just that. So it is a very broad topic. So if there's anything specific that you guys have questions about, wondering about, please ask those questions. So I'm going to get started here and share my slide if I can figure it out. All right. Can everybody see? Yes, everyone can see.
Looks great.
All righty. So we'll kind of do a quick overview, but what I'm looking to kind of touch on today is just like, what does child development look like from my standpoint? Obviously, there's incredible minds and workers in the room. Like, we've got birth workers, I saw when I looked at the Whova app. We've got social workers. We've got just this great mix. And my perspective is there just can't be enough of that, because being in medical, we do tend to be our own island, and we forget that there's so much out there that is so informative to what we do. We tend to be like data research, and we forget to open our minds and our hearts to our community and see, other things at play that can help our patients. So I do try very hard to, get out of the medical bubble and into the real world, as I call it. We'll talk about high impact focuses, the key players, and then, how we can advocate and how we can be involved as a community. So a basic overview are the domains of child development. What are we looking for when a child comes in and we are assessing development? And this is from a pediatrician standpoint. We are really looking for, these 4 domains of like, are their motor skills up to par? Are they, are they using their little pincers? Are they, swiping the food from the table and throwing it on the floor? Really simple things, but things that really matter when they're missed. The sensory skills, of course, play heavily into early detection of autism. So we look very closely for those, and the social skills as well. As far as COVID's concerned, social skills are probably the front and center concern, because we don't have a lot of data on what is going to be for those kids, right? They are still in school, still growing up. So we have some idea. We have a little bit more when it comes to autism because we could see the effects more drastically. But I think in about a decade, we're going to be having a completely different conversation because that data is going to keep flowing in and show us really what happened, because that preschool age and that, birth to 5 is so critical. So the kids that went through the pandemic, it's going to be interesting, and it's going to be something that we really need to watch for as a group. And then cognitive skills. So of course, if we're missing sensory skills and social skills, cognitive skills are something that they're a ripple effect, right? We want to make sure that, if their speech is delayed, is their reading delayed, is their learning delayed, it kind of all flows together. So we really need to pay attention to how all of these go together. So kind of the phases that we're looking at with development, and I've kept it to the birth to 5 just because we can go on and on and on and on. But we've got that gestational age. So gestational age, as far as screenings, what we're looking for in terms of COVID, again, we're still learning. We don't really know gestationally the impacts of those children quite yet. But in general, we do know that socioeconomic factors are a huge play after COVID. It just laid bare everything that was already breaking. So when we talk about gestation and development, we're really thinking nutrition and exposure to toxins. And, after COVID, that just, access food, like food deserts and things like that, they've just gotten worse, especially from, what I've seen in practice. We're really struggling to get people adequate resources as it is. And then COVID comes along and some stuff just vanished. I'm like, okay, we can no longer use that. So one of the examples of that is like making sure people take their prenatals, making sure that they have access to those prenatals so they get those vital nutrients to prevent those neurotube defects or those things that can cause developmental disabilities. And the difference between, and all of you know this because you work in this, but the biggest difference between developmental disability and delay is the disability is lifelong, and they can progress and they can achieve a lot of function, but it is something that they live with, whereas a delay, we can catch them up. So we look for both, but we do a little bit separate screening for both. Like I'm not going to do a well visit for a child with autism the same as I'm going to do for a child that has a mild speech delay, right? It's going to be a totally different conversation of how we're going to meet. Those milestones have just adjusted now. Then we've got our neonatal period, which is the 4th trimester. Why we're all here, right? The most, I feel like it's the most looked over period, where we've got that deficit and attachment focus. And one of my backgrounds is when I was going through the pandemic as a provider, a lot of the WIC offices were unable to do that feeding lactation face-to-face. So I went and I got my lactation certification through a Healthy Children Project, and I became a CLC. And the whole time I was just thinking to myself, okay, how are we not learning this in medicine? How is this something that is not being done routinely or required by medical professionals, because it's the first thing that parents do as parents. It's the first thing that gives them confidence or breaks their confidence. So after I did that, it became a part of my practice, and therefore I saw all the effects developmentally, right? We've got that attachment, those newborn attachment phases where if you ruin a parent's confidence, especially a mother who's trying to breastfeed or just, is struggling with formulas that their baby is not tolerating, and they're not getting that adequate education, and that education where, it's actually helping. We have a lot of dissension in medical about how we teach infant feeding, and not all of it is actually that helpful, as I've come to find. That was my experience as a mother. I was a provider, I was pregnant, and for some unknown reason, no one could help me breastfeed my child. So that led me on that journey, and that just folded right into development. I'm like, okay, this is it, that attachment where they're on your skin, where you feel you have a bond with your baby, the lack of shame when you actually feel like you know what you're doing. That is just such a huge piece of it, which is why I love the work that's done at fourth trimester, because it's not being done. It is the rare provider that we're finding that actually does do lactation. A lot of people refer, which is fantastic. However, having an infant and seeing them that third day of life can make or break that relationship. So if a mom is coming in wanting to feed her infant in a specific way, and the person that she's seeing first does not have those skills, we may have already lost like this huge critical part of that infant's feeding, and therefore their development and their attachment with their parents. So something to really, going forward, look for those gaps and fill them in any way possible. I do not see a future, in the near future, a bunch of providers going out and getting lactation certified. I feel like there's a lot of people in the community that have been really asking for that and providing resources. And there's just this old mindset in place. I don't understand what it is. I wish I could explain it. But anyone who's worked with any primary care providers, that stick to the old scripts can tell, it's like, oh, your baby's not growing. Let's just switch them over to formula, regardless of what the parent really wanted to feed their child with. So feeding is a huge part of that fourth trimester, because it is the first part. And then, of course, just it's a huge launch pad for how to teach parents how to parent that confidence. And that plays directly into all the other developmental stages. So when I have patients that are in that phase, feeding is actually the biggest thing I focus on. Then we've got our toddlers. So before our toddlers, our 4 to 18 monthers. And they are just really, they're fun, right? You get the boundaries that they're pushing. They're starting to learn about their world. And obviously in COVID, if you were in that age group, you were not going to parks, you were not exploring your environment. So monitoring those kids closely for any sensory issues, monitoring them for any, issues with social settings, lots of people, we do try to keep close track of that. We've got our preschoolers, that's those social skills, probably arguably one of the most important phases for social and language development. Kids who were not able to go to preschool or be around peers during the pandemic, really close eye on those kiddos, because we are already seeing in the older groups massive anxiety, massive panic when it comes to large groups or going out in public or even going to the store. One of the other things that I do in my practice is I do an older cognitive behavioral therapy program, and the majority of what I see are children that are afraid to go to school. They're online school because they just can't handle being in groups. And I think there was a little bit of that before the pandemic, but definitely that broke that, floodgate open. And now we have a lot of kids that, going to Target is actually very anxiety driven for them. They're like, nope, won't go out of the house. They want to stay with their same 2-3 people that they see all the time. And they're coming saying like, help me. So we know what that looks like for an older child. It's still developing as far as what that looks for younger children. Of course, younger children are more neuroplastic. They are they bounce, they really do. So there is some hopefulness there, because I think we like to see everything as very dire, the pandemic came and all these bad things happened. But the wonderful thing about working with children, especially young children, is you can catch them up, and they really do bounce back. They catch on quickly. So there is some definite hope there after COVID. And I will say, so, the well visits that I see, the kiddos in those age groups that have gone back to school, it's reassuring, if they didn't have to deal with something like an autism diagnosis, or a developmental disability. I will say the typical child that comes in seems to be overall doing well. We're not seeing a ton of issues. But the speech delays were a thing. Those were something that really, really were backlogged on. And I'm sure all our speech therapists on here can agree that their schedules are very full, because that's what we refer for most is speech delay, speech delay, speech delay. So we already talked about the developmental delay versus disability. The massive impact of that. I mean, 1 out of every 6 children right now has some sort of developmental disability, which is a huge, huge population, when it comes to how short we are with developmental pediatricians, and just in general, that whole field is underserved. So I put this quote here from AAP just because it really shows 758 board certified developmental behavior pediatricians. That's who you go to for your diagnosis and your coordination of care after you see your primary care doctor, for 19 million children. These kids are not getting seen in the window they need to be seen. Most of us who take care of kids with autism, we know it's going to be at least 9 months before they get through the door to be seen and get their diagnosis to even start to get set up for their services. This is one of the reasons is there's just not a lot of providers going into that field. Then on top of that, we also have a massive shortage of primary care providers. It's no longer pulling MDs in. There's a huge shortage of physicians wanting to go into that field. And it doesn't seem like the mid-level practitioners, such as nurse practitioners and PAs, are going to be able to necessarily fill that gap either. So that means way less screenings, less early intervention if we don't have people that they can see. In Arizona, I was reading through some of the HRSA data. Some of the rural providers, the primary care providers, are a provider to 5,000 children. So there's just no way we're catching all the things that we need to catch. And if there's anything from this, presentation that you take away, is we need to get creative. Providers are not going to fill this gap. And I think that shortage will only get worse, not better in the future. So we really, as a community, need to figure out, more collaboration, and our pediatricians need to start reaching out to our community, to our social workers, to our speech therapists, and working together. Because if patients have to go through us, and a lot of the access population has to go through their primary care provider to get to one of you guys, to get to their speech therapist, to get to counseling, then it's just going to be long-term. It's going to continue to backlog, and there's going to be kids missed. And then we've missed their developmental window, especially when we're dealing with delays. Okay, if they're, in that toddler period and they're starting to develop a speech delay and they have to wait in line to even be assessed, we've just thrown their speech back. They're going to be behind in speech, and then they're going to start school behind. And then we start to deal with the issues of, shame at school, right? Oh, I'm not keeping up with my peers. And that can be devastating to those kids in school age, years. I'm not as good as everyone, so I'm just going to give up. And then you've got deficits in reading and language. So it really does spiral all the way through when we don't have the ability to identify and correct quickly, especially with the delays. So yeah, the shortage issue is really probably front and center for how we, can go forward and make some things better. And then of course with COVID, we know that there was with the access population, which is our Medicaid population, the emergency COVID order ended. So there will be some kids that have delays in care because we don't have insurance for them yet. So we have been seeing a little bit of that where they're coming in for sick visits then they're just paying out of pocket, but they're not coming in for their well visits. They're not coming in for any additional assessments. So there will be a period where, the kids that fell into that group where there was a gap in care, they will also have delay in their assessment, which we may see become more of an issue in the next 2 to 3 months. So high impact is how we can work together to figure out how to screen early, to make those referrals, working together and working with our healthcare system and working with our insurance payers. Just that community structure is going to be so key. Like I said, medicine likes to stay in their island and not reach out, but there's so many of these things that it's just, you can't do it when there's a line, for 4 months to see a specialist. We need other people trained to do these things. And then we need to allow insurance to kind of come in there and also pay for those things. I don't think you can talk about early child development without talking about maternity and paternity leave. I will share a few stories with you. I've had this happen more than once, so I feel pretty confident about sharing this story. I have young parents come see me and their baby is not developing quite as expected, but nothing necessarily wrong. And I've started to ask more questions, and we are seeing like a lot of strange head shapes, right? And we know that's been a thing for a while. And I started asking these young parents, I'm like, okay, what's going on? Like, oh, well, one, we're gig drivers. We didn't have any paternity leave or maternity leave. So dad drives during the day with the baby while I sleep, and I drive at night with the baby, and we stop to feed them the bottle. The baby never leaves the car seat. So ignoring socioeconomic factors and the issues with paternity leave and maternity leave and just, the lack of support for families. I mean, that's half of our battle probably for those developmental delays. So this poor family was just driving day and night, and this baby was not developing simply because they just didn't have anyone around them to actually play with the baby or have time to get that baby out of the car seat because they were too busy working and trying to pay for the formula that was not covered by their WIC. They had to have the baby on a specialty formula that was not covered. So we had to go through quite a process to get the baby that formula before they were able to have some relief because it was an expensive formula. Increased feeding support. I believe it's just the first line. You get a parent confident in the way that they feed their baby, however they have chosen to do it, and that their baby is thriving and they're not having, stomach issues or breastfeeding issues. That first confidence can just like go a long way for a new mom. And that's something I see in practice every day. And that's why I keep going back. That's my favorite part of my practice, is because I do have that training and I get to see them, 6, 7 times that year, plus a few times in those early days. I get to see that confidence grow from that. And I really do see a difference between the moms who were not able to feed their baby in the way they chose, and they felt like the failure, they felt like they couldn't do the rest of it, versus the moms who overcame that first hurdle of feeding. The confidence level is just so different. So that's where I focus a lot of my practice attention. So I always add that to any developmental thing, because I think that is just first line. So these are I pulled this right from the CDC. Just what does it look like to do a developmental evaluation, right? And the first line is always going to be our community, our parents, our grandparents, our caregivers. And they're the ones that are, noticing when something isn't quite right. Now, this becomes a little tougher when a lot of kids are having more speech delays, or they're just delayed because they're not being stimulated, right? They're not in any sort of social environment. They're not being put on the floor. They're not being played with. They're being put in a swing because parents got to work, parents got to pay the bills, parents got to put food on the table. So you're seeing probably a little bit less early detection from families in certain, especially those low income circumstances. Creative solutions, again, that is what we need. We all work together, right? But there are checklists online. There have been some controversial things about the developmental milestones on CDC. I'm well aware, and probably everyone here knows that it's an issue. But getting to see them, a few times that first year really does help me to guide that. Again, if they're losing their insurance, I'm not going to see those babies as often. So that plays into that monitoring as well. Screenings are what I do. I very rarely will diagnose a developmental delay or disability. I am mostly screening for it and sending them on. So we do our screenings pretty heavily. There's the standard ones, the developmental ones at 9, 18, and 30 months that the AAP have recommended. I typically just start my screenings from day one. I start with the feeds, then we talk about a lot of anticipatory guidance as far as developmental progression, and I start with tummy time from day one. Used to be 2 months, and we're finding that put a lot of milestones, especially those gross motor skills, behind a little bit. So we're doing a lot more early intervention. And then the evaluation, that's the issue that we're having the most trouble with post-COVID world and just in general. That is those child psychologists and developmental pediatricians we just don't have. So the lines are incredibly long, and a lot of kids need to be able to see them before they get their services in some instances. So ABA is one that's usually delayed because of not being able to obtain official diagnosis and not getting, that state insurance. And then our key players, all of us here, everyone here works with babies, right? Our birth workers and infant feeding specialists. You guys are like the most important thing in my world. If I could get my population of Medicaid patients covered, I would have every single person have a doula, someone at their side helping that mom recover and feed. That is number one for me. Our primary care pediatricians, getting them on board, figuring out the messaging. I've tried, I believe. There are a lot of amazing pediatricians out there that are very progressive and they are doing this work. There's just not enough of them. And it's very disheartening when you come across a colleague that doesn't care about infant feeding or doesn't care about screening for autism at, 2 years old. It's very interesting because it doesn't seem like that should even be a thing, but it is. Our developmental pediatricians, I think we have maybe 3 in the state, bless their hearts. They are very busy. Our occupational speech therapists, I've learned so much from them about infant feeding. I try to get all of my educational information from people who work with those kids on a daily and work with the problems. And I will say occupational and speech therapy has really informed my practice. And I try to go to their bubble of research as much as I can when I'm educating parents on prevention and anticipatory guidance. Our schools, that again could be a whole nother discussion as far as, what's the role of schools in early intervention and development. The schools are also in crisis. I don't know how much we can rely on them. Before COVID, I felt pretty confident about sending a kid to get, a psycho evaluation from the school. Now it's hit or miss how well they do, what they're diagnosing, what they're actually getting out of that. I've had kids with, pretty severe developmental delays or disabilities that are getting kicked off their IEPs because they just don't have the capacity to do it. I did have a few children that were older with autism that got kicked out of the schools for violent behavior, which was very upsetting because they didn't actually support those families. The kids had nowhere else to go. Other school districts wouldn't accept them. And I felt like that was a huge failure on the school system's part. No one was evaluating this child with autism, that there was no support for that kid. So I love our schools. I think they're drowning and they don't necessarily have the solutions we need right now. So again, another room for creative solutions. Our early intervention programs, who are also very swamped. And then of course, the big one is who's going to pay for the services, right? If they're not paid for, getting a child into services is just not going to happen. It's hard enough sometimes to convince parents that their kids need those services, and then they hit the paywall. And that's a huge barrier I found, is hitting that paywall as soon as they're like, okay, we're on board. Yeah, it's a delay. Let's go get it looked at. And oh, just kidding, we don't actually pay for this. So there's a lot there.
Catherine. Oh, sorry.
Yeah.
Did you? I was
You're
going to interrupt for questions here, but
perfect.
if you're wrapping up, or if you want to say
Yeah,
something
I
else
think I
about.
covered most of this throughout the presentation. So I think the only thing we didn't really cover was like autism specifically. Those are where the robust studies are coming from as far as like delays in care are most, detrimental. And that's where COVID really hit the hardest, was those kids that had autism and couldn't get to their therapist. Everything was through a screen. We are still watching them and we are still dealing with the delays there. So absolutely, questions, anything. Again, we could talk for
Yeah,
hours.
Raquel, do we have any questions in the chat? I mean, Jenny has a great comment here about what you were just mentioning. Um, any other
There's
questions?
no questions at this time. But I agree. Jenny has a great comment. I don't know if you can read it or you would like me to read it to you.
Can you read it to me? I can't see it. Oh,
Yeah,
wait.
so Jenny says your comments about some pediatricians not wanting to look mirrors my experience. My son was screened with the MCHAT at 18 months and he passed. My pediatrician just kept telling me my concerns were unfounded despite his delays. He was finally diagnosed with autism at age 3 when our preschool referred us, and he was too old for AZ IEP. It was so frustrating. And
Yes.
I know people that deal with that same thing as well. It's just so unfortunate.
Very frustrating.
Oh,
I do see this
there is
one
one
too.
more question that just popped up. Do you have ideas of when to refer to speech and when to wait and see?
For me, and I don't speak for all pediatricians, but for me, it's always collaborative. It's a conversation with that parent. What were your other kids like? What do they look like? Like, was there any delay before? My go-to is always early. If I can convince a parent to go early, I'm like, what's the worst that can happen? They're better at speech, and if we delay it, there's a lot of, like we were talking about, that shame, where like kids aren't keeping up, and I never want a child to feel delayed. So for me, I refer as soon as they're not meeting the like bare minimum. I'm like, do we think there's a delay? They're not saying the amount of words they're supposed to be saying, and it doesn't seem like they're progressing. If they are progressing and they think that they're saying more than they were, let's say like 2 months ago, I say, okay, let's give it maybe a month or two and see if we're ramping it up. But if we're not progressing or we're regressing, let's send them. And it just depends on, what I'm seeing. Each and every kid's a little different. And it also depends on the parent. Because like I said, therapies do take time out of parents', work schedule too. And not all of them can afford it, especially the population I work with. Going to another doctor's visit is like so stressful for them. So I do try to like balance what I think the child really needs and what I think the family's capable of as well. If they're like, yeah, let's do it, I'm making referrals left and right. I try to get them in as soon as possible. How can we best support our ASD community members and their support systems? Oh, lovely. Again, another presentation. One of the things that we're really drowning about is the fact that there's so few specialties who can actually make that diagnosis. In my opinion, the backlog should not be whether they have autism or not. It should be like, oh, maybe our state can't fund, DDD is the big thing we look for when we go for that official diagnosis so we can get them more services. They tend to make the backlog the diagnosis piece of it. If the backlog's in the funding, we can have a different conversation, right? But getting more people certified and allowing, asking our policymakers to open up that diagnosis field, because right now there's just a psychologist, a neurologist, and a developmental pediatrician, I believe, and psychiatry. But I have sent kids to neurologists to get their diagnosis. Neurology has not been diagnosing them. They will refer them to developmental peds, to that long line. So getting more people under that umbrella who can give an official diagnosis will help, because it's all about that early intervention with autism. Did I answer that question enough?
Put in a thing about AZEIP too, Catherine.
Yeah, so AZIP is amazing. They did lower their age though, so it has been a struggle. So if you are, their wait last time I was referring to them was about 4 to 6 months. So if you're over 2, and I'm referring, they only see you till you're 2.5. So if you're going to be 2.5, by the time you're getting there, they're not seeing you. So it's that early detection is what I'm pushing now because of AZIP. I think they had to, you know, when you're that overwhelmed with kids, there's probably a lot of assessment they're doing that they just couldn't, they had to cut it off somewhere. Yeah, so we have had, since they cut it from 3 to 2.5, we have been having issues with that, because if we're just seeing that kid at 2 and we haven't seen them before, they're coming in late for their 2-year well visit. Well, now we're going to developmental peds instead of AZIP. And I loved AZIP. And before COVID, they were like my go-to, everyone's going to AZIP. But because of that age change, it has changed how I refer.
Thank you for that. That's very helpful to know.
I think there's just a lot of good resources in Arizona, but they're all strapped. And that's the biggest issue, is we don't have the human services we need. I even think probably funding wouldn't be the primary issue. It's getting the people to do the actual work of this. It's just more and more people are flooding out of the healthcare system after COVID. So, you know, ideals are kind of gone, but now bare minimum is also struggling. It was kind of doom and
all
gloom, I
good.
guess. We're struggling.
Yeah, all good points and great information. And thank you so much for giving us our update. Catherine, it was a great presentation. We now get to break for lunch. So thank you for everybody for the morning. If you want to network during lunch, we want you to send messages to attendees and participate in the community boards on Whova. There's a photo contest. You can earn points that way, and those all get you toward winning a prize. And then visit our sponsors in the sponsor tab on the Whova app. And we are going to wrap up our morning and see you back here at 12:30. So go enjoy your lunch. Thank you to everybody for participating in the chat today.